An ICU nurse went viral for quitting after 19 grueling months of the pandemic. Now he says he's more relaxed and is encouraging other healthcare workers to do the same. There he is right there. Andrew Hudson's video on why he quit nursing in December 2021 has 500,000 viewers on Twitter. Andrew Hudson had nervous breakdowns after working in ICU for 19 months during COVID. Hudson posted a video explaining why he quit, and it went viral with 500,000 views on Twitter. He said he's happier podcasting and creating art and encourages other nurses to quit. Before nursing school, Andrew Hudson worked at a bar for 5 years where he became familiar with the smell of Tito's vodka. In early 2020, as Hudson treated COVID-19 patients in a step-down unit. By the way, a step-down unit is like when people might have come out from surgery or what have you, but they're not that critical to be in ICU. But they're not that stable enough to be in the regular ward. So step down unit, even though it's not ICU, you still have a lot more patients you're gonna deal with than if you were working in ICU. He noticed his hand sanitizer and smelled like booze. He looked down at the packaging, saw a Tito's label. At the time, the U.S. allowed distillers to make ethanol-based sanitizers due to a nationwide supply shortage, crippling healthcare's pandemic response. Hudson laughed as he recounted the ironic twist of fate, but said, "These kinds of federal stopgap measures and the overall lack of support he and other nurses received led to burnout and mental health distress in his nearly 2 years as a COVID ICU nurse." Hudson said he did not receive any hazard pay working between March 2020 and December 2021 as an ICU nurse in Michigan and Colorado. He reused masks and gowns and sent his patients' bodies to freezer trucks outside of his hospital. So I'm not sure if he was a traveling nurse. He worked in Michigan and Colorado, so sounds like a traveling nurse. By the end of his tenure in the ICU, Hudson came home from shifts in nervous breakdown. Hudson finally quit nursing in December 2021. So 2021, and today it's the 30th of January, 2022. So he quit last month in the now viral video that has 500,000 views on Twitter. I'm not gonna play the video. I'm just gonna put the link. Anybody wants to see the video can check it themselves. Hudson said helping patients for months without proper staff and equipment feels like emptying the ocean with a bucket. The way it is right now isn't normal, he said in an interview with The Insider, and I don't think it's helping patients in any way. Hudson's first few months treating patients with COVID were a whirlwind. His team would experiment with the now-debunked treatment, hydroxychloroquine, because back then no clinician knew for sure how to treat the disease. With his voice low, Hudson recalled calling 30 rapid responses in 2020 when his own patients went into a critical level, and many more for other nurses' patients. In the early months, Hudson bagged up dead bodies and brought them to the morgue, and sometimes freezer trucks brought to the hospitals to store bodies when death rates were over 100 per week in Michigan, several times a night. What's worse, to protect morticians from exposure, Hudson gauzed and taped the eyelids, nostrils, and mouth of his dead patients. It felt macabre, he said. It was pretty grim to look at, and I felt like this feels kind of medieval in a way. You see insufficient staffing, aggressive patients, and nervous breakdowns. In 2021, Hudson moved to a small hospital in Denver, treating underserved communities. He was again met with treating mostly COVID ICU patients due to the Delta variant. Due to staffing challenges, Hudson said he cared for at least 3 patients at once. Safe staffing laws in Massachusetts recommend nurses care for just 1 ICU patient at once. And research from the University of Pennsylvania finds the more patients a nurse must care for, the worse care becomes. Hudson's hospital hired travel nurses and newly graduated students to help on ICU floors, but their lack of experience wasn't enough to help manage the pandemic's toll. Last year also brought out aggression from patients he hadn't seen before. Patients' family would tell Hudson not to intubate dying patients and instead give them the ivermectin, a parasite killer that does not work against COVID-19. We just feel like we are vanquished, like we can't do anything, he added. Shortly before leaving his job, Hudson recalled coming home from his shift feeling defeated. Hudson said he became a nurse to help people and make a living wage out of it. In the last 2 years, he felt he was no longer making a reasonable wage for the unprecedented amount of work he did, and felt no matter how hard he tried to help, his patients would continue to die. See? And Hudson handed in his letter of resignation in the second week of December. Though he felt bad for his manager, he does not regret his decision. It was kind of the Wild West, he said. The units were a mess. We didn't have the resources we need. After spending some time with his family over the holidays, Hudson threw himself into hobbies, a comedy podcast he co-hosts with his friends called E1 Podcast and Digital Art. He said he used some time to decompress due to the stress of the past 2 years. Hudson has a message for other fed-up healthcare workers. Quit. If you quit, who's going to take care of those people in the hospital, right? If everybody would take his advice. You need people in there, in the hospitals, to take care of people regardless. I'm encouraging healthcare workers, not just nurses. If you can leave your job, I think you should, he said. I think that they should see that they need us more than we need them. And the system is already collapsed. But now they're going to have to deal with the ramifications that collapse. Well, this is very unfortunate that somebody who went to school, trained, and it's not that easy because you got to do like so much extra training to do like critical care nursing. Even when you do the like basic life support, they do an extra training for that. Like when you resuscitate people, pulmonary resuscitation and so forth. If somebody goes into cardiac arrest, So they spend a lot more hours training. It's kind of nerve-wracking, the amount of training you gotta have, all these things and all these shots like MMR, measles, mumps, rubella. You gotta have that shot. They check for different things. It's not easy. But some of the jobs, some of the jobs you can just go, you get hired. Nobody's checking all this stuff. But in nursing, you gotta produce. This is why I laugh when people complain. Well, they don't want to get shot, and then you had like two nurses out in Long Island. I don't think I did a story in that. They collected like close to $1 million with phony COVID vaccination cards, and they entered that into the system, saying that these people were vaccinated. And one nurse had like, I think like over 900 and something $1,000 in her house. And one of them, her husband is a policeman here in New York City. So they're trying to see if if he knows anything about it. Well, I tell you what, if you're a policeman and you don't know your wife has over $900,000 in your house, there in cash, not in bitcoins or cryptocurrency, but in cash, then something is wrong with you.